Perfect. Hey guys, Dr. Will here from Miami Spine and Performance. Today we have Jesse, one of our loyal patients, rocking the Miami Spine and Performance shirt. And we're going to show you guys what a typical maintenance adjustment looks like. So Jesse's obviously a young, healthy guy, so he doesn't necessarily have any acute injuries, but he does sit at a desk a lot at work, so he has a little bit of tightness in his back and neck. So we're going to show you guys exactly how we take care of that here. So Jesse, I'm going to have you please lie on your back for me. So the biggest problem area typically with people that are working at a desk is going to start with kind of the upper back in between the shoulder blades. Usually we're kind of slouched over like this. So what we do with an adjustment is we help open up that range of motion. And that's exactly what I'm going to do here. So I'm going to have you cross your arms for me. And I'm going to start a little bit lower. I'm just going to kind of check and see what's moving, what's not moving. So I can already feel kind of through this mid-back between the shoulder blades. We're a little bit stiff all the way down through here. So I'm going to start right through this area, and we're just going to roll over. Coming up through here. Nice. One more. Perfect. Awesome. Let's have you roll on your right side, please. All right. So you were saying you're having a little bit of low back soreness?
For sure, yeah.
Typically sitting at your desk?
Yeah.
You're sitting in the car a lot, or mostly just desk?
Car and desk.
Car and
That's
desk.
like 90% of my day.
Biggest culprits, car and desk. All right, scoot your hips towards me, please. Okay. So again, we're going to check. We're looking at the low back here, tailbone area. You can feel a little restriction through the SI joint on this left side. Is your back pain usually in the center or one side or the other?
I'd say usually the left is worse.
Left side. So we're going to do a little drop here, and again, we're just putting a little bit of motion through the joint, so it's going to move a little bit better. Big breath in, breathe out. Perfect. Other side. Good. Scoot towards me. What are you doing exercise-wise these days? Running, weights, sports?
Usually just weights.
Weights.
A little bit of cardio.
Mostly arms, chest.
Usually skipping leg day.
Skip leg day, yeah. Scoot your hips towards me. Good. Breathe out. Keep going. Perfect. Face up, please. Just face up. Yep. So now we're going to check the neck again. Typically, with a lot of sitting at the desk, you can jump your head here. Sitting at the desk, we get a lot of tightness in the neck. Also, depending on your pillow, mattress, what kind of sleeper you are, that can cause an issue as well. You're a pretty good sleeper, Jesse?
Yeah.
Yeah.
I'd say so.
All right, so let's get in and see what's going on here. Again, I'm going to really take my time, make sure we find the area that needs to be adjusted. Feel that there? A little sore?
Yeah, for sure. Yeah. Worse on the left.
Yeah, and then right, we got a little bit up there, right through there. All right, so we're going to adjust this left side C2. I'm just going to bring this head over, just let everything go. Perfect. Nice and easy. And then we're going to hit the right side, actually all the way up in the occiput. I'm going to poke his chin out. Perfect. All right, last but not least, we're going to check the feet, see if the feet are moving well.
Wow, that neck was insane.
Yeah. Yeah. The cool thing about the neck adjustment is because your brainstem is right there, you almost get like a full body relaxation. Yeah. Sometimes people will feel that. All right, so we can see he's got some pretty good arches here, but a little bit stiff through that midfoot. So we're just going to put a little bit of motion in there. Just let everything go, Jesse. Perfect. Same thing here, even better on this side, but still a little bit movement. Awesome. Alrighty guys, well that's what a typical maintenance adjustment looks like at Miami Spine. We'll throw Jesse on the decompression table, do a little bit of soft tissue work, but from an adjusting standpoint, we do full spine, we do extremities, and again, it's different for everybody. So everyone has their problem areas. That's what really makes us unique is we don't have like a cookie cutter protocol for every patient. every time a patient comes in, I'm going to check and see exactly what they need so that they can have a, pain-free, whether it's 2 weeks, a month, 2 months, make sure that they stay pain-free and their spine is healthy. So make sure to hit the like and subscribe button, guys. See you next time.